without any further delay, I'm going to turn things over to Mary Dale Lancaster. Mary Dale is with the Reading Commission on Aging, and they are the ones who brought the program to us. And so we're delighted to have them with us. And Mary Dale, I'll let you then go do the other introductions.
Yes, hello. Hi, I'm Mary Dale Lancaster. I'm Chair of Commission on Aging. First, I'd like to thank the Mark Twain Library and Sarah Atwood from the Commission on Aging for bringing this program together. Quickly, the Commission on Aging functions as a policy review and planning body on all matters dealing with aging. It analyzes services provided for aging citizens in the community through both public and private agencies, and we report directly to the First Selectman. We are always seeking input from the community, and we welcome your ideas. October is when Medicare sign-up begins, and there are always a lot of questions, and we are so thrilled to have a member of Choices here. The Choices program, and Choices stands for Connecticut's Programs for Health Insurance Outreach, Information, Eligibility Screening, is designated as the official state health insurance program for Connecticut. It's funded in large part by the Centers for Medicare and Medicaid Services and the U.S. Department of Health and Human Services. It provides unbiased information and counseling on Medicare, Medigap, Medicare Managed Care, Medicaid, Medicare Savings Program, and long-term insurance and other related programs. We will also have a speaker here from SMP. She will describe what she does in more detail, but it has to do with fraud. Our speaker today for Choices is Francesca Evangelista. She became a Choices Regional Coordinator in December of 2019. Prior to her hire, she worked for the Western Connecticut Area Agency on Aging, WACA, as a care manager, and for the Connecticut Home Care Program for the Elders, as well as a Waterbury outreach worker for the BRASS program. Francesca is bilingual in both English and Spanish, and she has over 4 years of experience with Choices, one-on-one counseling, educational presentations, and media outreach efforts. And Francesca, I will let you introduce Audrey when the time comes. Without further ado, I'd like to introduce Francesca.
Well, thank you very, very much. And as Ms. Mary Dale Lancaster mentioned in that wonderful introduction, the Choices program strives to provide free and unbiased information for beneficiaries about their health insurance coverage options, as well as their eligibility for both state and federal assistance programs that can help reduce the cost of medical coverage. Choices is part of the Western Connecticut Area Agency on Aging. We're located on 84 Progress Lane in Waterbury, Connecticut, and we serve 41 towns in the Western Connecticut region, including Reading. For the state of Connecticut, there are 5 area agencies on aging. So anyone in the state of Connecticut is able to access a Choices counselor for supportive services related to health insurance counseling, as well as supportive services for anyone who is aging or may have a disability. So in my PowerPoint today, I'll be able to provide you with our contact information, as well as our national phone or our statewide phone number, so that if you have a friend who lives in another town, they can call that 1-800 phone number and reach their Choices agency. So again, thank you all for joining our Choices program this afternoon for our presentation, Getting Ready for Medicare Open Enrollment 2021. Medicare Open Enrollment period happens to be one of our busiest times of the year. And as you might imagine, Medicare is a complex topic to discuss with beneficiaries. So for today's presentation, we hope to provide our audience with an overview on Medicare, what items you should consider when selecting a Medicare plan, an overview of the state assistance programs available to help reduce the cost of Medicare. We would also provide you with an introduction to the Medicare Plan Finder tool. And we'll also provide you with Medicare fraud information, particularly relevant to COVID-19. How do you feel when you think about Medicare open enrollment? Many of our callers confess that Medicare is extremely confusing, and they feel like they have to put pieces of this Medicare puzzle together on their own. We have also had people say that Medicare is one of the most frustrating topics to review for them because it's difficult to keep track of the coverage rules, benefits, and where to go for care. I'll start this presentation by saying that the Medicare open enrollment period occurs every calendar year from October 15th to December 7th. And during this period, a Medicare beneficiary can join a new Part D prescription drug plan under Original Medicare, join a new Medicare Advantage plan, switch from Original Medicare to a Medicare Advantage plan, or switch from Medicare Advantage plan to Original Medicare. Our choices counselors encourage callers who inquire about what type of Medicare coverage they should select to consider the following items. Are your healthcare providers part of the plan you're interested in? Are all or most of your medications covered under this plan? Should you use a preferred pharmacy or switch pharmacies to access less expensive prescription copays? Does the plan include benefits that are important to you? What is the total cost of the insurance premiums, deductibles, and cost sharing amounts? And is it within your budget? And lastly, be mindful of any potential fraudulent offers that you might see. Our Choices Department also strives to educate our callers on what they should be receiving and reviewing every year. 2 important notices to read as you prepare for Medicare open enrollment are the annual notice of change, which will notify you of your current plan's coverage changes, including cost of services and service area information for the next year. And some plans have already mailed this out to beneficiaries, but everyone should receive this notice by September 30th. The second notice to review is the evidence of coverage, which provides similar information, but is not mailed directly to the beneficiary anymore. You'd be able to access the evidence of coverage document sometime early this fall, and it varies by plan, but it should be available on your plan's website. So now I'm going to provide a brief overview of Medicare, and I tried my best to make this as simple as possible. Medicare can be best explained in 4 different parts. Part A is hospital inpatient coverage. Part B is medical outpatient coverage. Part D, prescription drug coverage, is for Original Medicare. We have Part C, Medicare Advantage plan, which is the alternative method of having your Medicare benefits administered. And our 5th and optional part is referred to as a Medigap plan. Medigaps are separate insurance policy that beneficiaries with Original Medicare can purchase to cover coinsurances attached to their Part A and Part B services. Excuse me. When it's time to sign up for Medicare, you have 2 options on how you would want to receive your Medicare coverage. Option 1 is Original Medicare, which includes Part A and Part B coverage and is represented by the red, white, and blue Medicare card that you should receive by mail. And it includes a Medicare number specific to you and the effective dates for your Part A and Part B benefits. So effective dates are the start date for your hospital and medical coverage. In Original Medicare, you must purchase a Part D drug plan unless you have employer coverage or creditable prescription coverage like TRICARE for veterans, for example. And as mentioned on the previous slide, you can choose to enroll into a Medigap policy to help cover your Medicare coinsurances under Original Medicare, but this would be also an additional premium cost. Option 2 for your Medicare coverage is called a Medicare Advantage plan, also known as Part C, which combines Part A hospital and Part B medical, and usually covers your prescriptions as well under one policy, and you're unable to enroll into a Medigap plan. Medicare Advantage plans are best known as HMOs in Connecticut or PPOs, and to make it easier to understand, MA plans are also known as managed health plans, because the company that you choose will administer all of your Medicare benefits on your behalf. Now we're going to break down Part A, inpatient care, a little bit more. So Part A hospital coverage helps pay for inpatient hospital care, skilled nursing facility care, home health care, and hospice care. The Part A premium for 2021 is not yet available, but it's expected to be released later this fall. Most people have premium-free Part A coverage because it becomes automatic for those who turn 65 years old and have worked for at least 10 years and paid into Medicare via payroll federal taxes. If you don't qualify for premium-free Part A, you can still buy Part A. In 2020, people who buy Part A will pay a premium of either $252 or up to $458 every month, depending on how long they or their spouses worked and how much they paid in Medicare taxes. Part A hospital and patient coverage includes care that's administered in a hospital facility. And it's important to understand that the deductibles that we have for Part A, which I'll go into in the next slide, are based off the established benefit period. And I'll discuss that as well. Part A premiums are free for people who have paid into it in 10 working years. But for people who work less than 40 quarters, they would need to buy Part A with a premium. They would be responsible for either $252 a month or $458 if they have less than 30 quarters of working history. If you have to buy Part A and you don't buy it when you're first eligible for Medicare, your monthly premium may go up 10%. You'll have to pay the higher premium for twice the number of years if you don't sign up. The Part A deductible is paid per benefit period, and in 2020, the deductible was $1,408. Daily copays are $352 a day from days 60 through 90 at a hospital, and $704 a day for days 91 to 150. Copays for a skilled nursing facility are $0 for days 1 through 20, but $166 a day if you must stay in a skilled nursing facility for more than 20 days. And it's important to understand the benefit period is when the beneficiary is admitted to a hospital or skilled nursing facility, and it ends when the beneficiary has had no hospital or skilled nursing level of care for 60 consecutive days. Now for Part B outpatient care, we're going to review the contrast, which is pretty much Part A is hospital care, and Part B is anything that you get done outpatient, specialist visits, PCP visits. Part B medical coverage covers medically necessary doctor services, outpatient care, home health services, durable medical equipment, mental health services, and other medical services. For a full list of the Part B covered services, people can visit www.medicare.gov. And in 2021, I'll add that there's a new benefit, which is acupuncture, and it will be offered starting January 1st. So that's a completely new benefit for 2021. The Part B premium also varies for higher annual incomes. And in 2020, it was $202.40 a month for people who are single and make more than $87,000 a year. And for married couples who made more than $174,000 a year. The premium is set at $289.20 a month for people who make more than $109,000 a year, and married couples who make more than $218,000 a year. The Part B deductible for 2020 was $198, which means that a beneficiary must pay that amount before Medicare will begin to cover their services at 80%. And with original Medicare, there are no co-pays, but there is a 20% co-insurance once the deductible has been met. Now, the third part of original Medicare, we reviewed Part A hospital and Part B medical. Now we'll get into the Part D prescription drug coverage. Before we get into our review of what Part D plans cover, it's important to be able to identify the following terms. A formulary is the list of prescription drugs that are covered by the plan. The formulary is divided into levels of coverage based on the type of usage that the medication is clustered into, and that's also called tiers. Tiers take into account the cost of the drug, and is classified based off of how that drug compares to other drugs for the same treatment, the availability of the drug, and the clinical effectiveness of the drug. So this chart kind of sums up what the tiers are divided into. There are 4 tiers in every formulary. And the best way to identify the tiers are tier 1 being the lowest copay that you pay out of pocket, which is usually for generic medications. And tier 4 is the highest copay that you'd be responsible to pay. And it's considered for specialty drugs and very high cost prescription drugs, usually brand name. It's important also to consider that some of our Part D drug plans have preferred pharmacies. And while the beneficiary may choose whichever pharmacy that they prefer, a preferred pharmacy will help them pay less for their medications. The Plan Finder tool on the Medicare.gov website allows people to compare pharmacies in any given plan for the state of Connecticut and review the copays ahead of time before enrolling. And that's something that the Choices program can help you access. So now Medicare Part D plans are sold by private insurance companies. In 2020, there were 25 plans available in Connecticut, and for 2021, we expect 27 PDPs to be available. Each plan has their own formulary. And if a medication is not on your plan's formulary, you'd be responsible to pay the full cost of that drug out of pocket. And the only way to get out of having to pay it out of pocket would be to have your prescribing physician send an exception appeal to the plan. For the year 2021, the highest monthly premium for a prescription drug plan is $135 a month. And this plan is the Anthem Blue Medicare RX Premium. But it's important to know that premiums are just one cost to consider, as each plan can have deductibles amounts to pay. In 2021, CMS also has launched the Part D Senior Savings Model to help beneficiaries save on the cost of insulin. So there are MA plans and Part D plans that are participating with this savings model and will allow beneficiaries who are diabetic and have insulin be able to choose up to 9 different plans, or choose from 9 different plans that participate with the savings model and pay no more than $35 co-pays for their insulin. But it's important to know that this is for specific types of insulin, and it's important to know that it'll only give you that copay for the insulin, and your other drugs would have to be in that plan's formulary to see the lowest cost copays. For the year 2021, the most inexpensive plan will be SilverScript Smart RX PDP, and the lowest cost Part D plan is at $7.20 a month. Part D premiums vary depending upon the plan, and I've listed here that they range from this, coming year $7.20 to $135 a month. Deductibles also vary depending on the plan that you choose, but the 2021 standard deductible is set to increase to $445. That means that you would have to pay up to $445 before the plan will begin to cover your medications at your lower copays. Now, the late enrollment penalty is an amount that permanently adds to your Medicare drug coverage premium. You may owe a late enrollment penalty if at any time after your initial enrollment period is over, there's a period of 63 or more days in a row when you don't have Medicare prescription coverage or other creditable prescription coverage. You'll generally have to pay the penalty for as long as you have Medicare drug coverage. The cost of late enrollment penalty depends on how long you went without the Part D coverage, and Medicare calculates the penalty by multiplying 1% of the national base beneficiary premium, which is set to be $33.06 for 2021. So it's very important to be mindful of the enrollment periods for Medicare, and to call, and ask questions if you are doubtful about whether you should apply or not. because these penalties can definitely be high. Now, to conclude our review of original Medicare coverage, I'll briefly discuss the Medigap plans. Original Medicare covers 80% of your medically necessary services and procedures once your deductibles have been met, and then the beneficiary is responsible to pay the 20% coinsurance themselves. A beneficiary might consider purchasing a Medigap policy to cover that 20% coinsurance if they have high-cost medical services regularly throughout the year. Most supplements will cover the coinsurance and the Part A deductible, but no plans will cover the Part B deductible any longer. And you might remember I said it was $198 for 2020. I'm not sure if that deductible will rise for 2021. Medigap plans or supplemental plans are sold by private insurance companies as well in the state of Connecticut. Depending upon a plan, the coverage might include Part A deductible coverage and coinsurance. For the state of Connecticut, the plans are classified into groups by letters A through N. Individuals under the age of 65 who are on Medicare would only be able to purchase a Plan A or Plan B supplement, and each standardized Medigap plan must offer the same basic benefits. What that means is that benefits in any Medigap plan with the same letter are the same regardless of which insurance company sells the plan. So for the state of Connecticut, all Medigaps are standardized. They are community rated plans. There is no pre-existing condition restriction if they enroll when they first become eligible for Medicare. So when you first turn 65, you can enroll into a supplemental plan. And even if you have a pre-existing condition, the Medigap has to take you on. Plan G offers the most comprehensive coverage, but it happens to also be the highest monthly premium for this coverage. Medigap plans do not offer prescription drug coverage at all. We haven't received the overview of what to expect for 2021 in terms of Medigaps offered in Connecticut, but this is what we had for 2020, and I believe it should be quite similar. Medigap plans no longer offer Part B deductible coverage. Individuals newly eligible for Medicare after January 1st, 2020 cannot purchase a Plan C or a Plan F. Plan C and F can be sold after 2020 if the beneficiary was eligible for Medicare before January 1, 2020. And individuals can purchase plans D or G or C and F with the exception of Part B deductible. So after that very lengthy description of original Medicare, this is a slide that I think puts a lot of things into perspective of what the pros and cons are. Pros are that you can visit any doctor or specialist that accepts Medicare nationwide. You have an option of buying a Medigap plan to pay for the cost of Medicare. Health decisions are made by your doctor and it's also in collaboration with you, meaning that you get to choose which hospitals you would like to go to, as well as which specialists you would like to see, and you do not need referrals to see a specialist. Some of the disadvantages to original Medicare is that there's no dental, vision, or hearing coverage. You have co-insurances attached to your coverage. And there's also a 3-day rule, which refers to when people are in need of skilled nursing services at a skilled nursing facility. They would need a qualifying 3-day stay in an inpatient hospital in order to be eligible for Medicare coverage at a skilled nursing home. So the alternative to your Medicare coverage would be Medicare Advantage Part C. A lot of times our beneficiaries are confused and they think that they need to show both the red, white, and blue card and their HMO card or their PPO card, when in fact it is the alternative. So that red, white, and blue card can be kept at home, secure in your records. It's not something we would encourage anyone to destroy or to lose. But once you've purchased an HMO or a PPO, then that will take the place of your original Medicare card. So Medicare Advantage plans are run by private insurance companies as well. And in the state of Connecticut, we offer HMOs, which are health maintenance organizations and operate in network, and also PPOs, preferred provider organizations, which do have a little bit more flexibility and have some out-of-network coverages as well. In order to enroll into an Advantage plan, you have to have Part A and Part B active. And that Part D savings model that is being launched in 2021 that helps with the cost of insulin is also honored by some Advantage plans for 2021. Excuse me. MA plans rule that they would not accept beneficiaries with a pre-existing condition. I wanted to preface this slide with the fact that there were some end-stage renal disease patients who were unable to enroll into an Advantage plan of their choice because that pre-existing condition was considered ineligible for enrollment. And effective January 1st, 2021, all MA plans should now accept end-stage renal disease patients, but there might be some large out-of-pocket costs for them. So when someone has end-stage renal disease, they have this option, but they should consider that the dialysis provider must be in network. And that's not something that we're able to see on the Medicare Plan Finder tool, which I'll go into in a few slides. In addition, with 2021 changes for Advantage plans, telehealth and acupuncture and hospice are added to the policies as well. The expanded coverage for acupuncture for lower back pain is included on original Medicare, so it must be honored by Advantage plans. There are stipulations with that though. It has to be chronic health pain, chronic lower back pain rather, and it has to be deemed necessary by a medical professional. Some of the additional Medicare Advantage benefits include dental care, vision care, hearing aids, transportation, gym memberships, and also some over-the-counter benefits. Some plans are even offering adult daycare center payment for 1 day a week. Medicare Advantage plans, some of the premiums do vary. There are many plans that offer zero premium Advantage plans, and it doesn't mean that you don't pay anything for the coverage. It means that they're not going to add a premium, a separate premium to your amount. Everyone owes that $144.60 for their Part B medical insurance coverage, and that will continue even if you choose an Advantage plan. Deductibles vary based upon your plan. And with Medicare Advantage plans, you are responsible for co-pays. However, there is a maximum out-of-pocket cost attached to every plan. It's also referred to as MOOP. In 2019, the amount was $6,700, which was the common MOOP limit. But beneficiaries should be mindful that there might be lower MOOPs associated with their plan, as well as some slightly higher maximum out-of-pocket attachments as well. So outside of the Medicare open enrollment period, which is starting next week, people on an Advantage plan are able to make changes to their coverage from January 1st to March 31st. If someone is not satisfied with the way that their Advantage plan is covering them, maybe their doctors are not in the network that they are in, they can switch to another Advantage plan during this period or switch back to original Medicare by enrolling into a Part D plan. This is only for people on Advantage plans though. Nobody who's on original Medicare is able to make changes during this time. Benefits of Advantage plans are that there's no 3-day rule for skilled nursing facilities. Advantage plans offer all-inclusive coverage for their hospital, medical, and prescriptions. Some additional benefits are offered like dental, vision, and hearing, and PPOs may have a wider network that you can choose from. Disadvantages are that you usually have to stay within network for most plans. You might find higher co-pays for out-of-network services. You might have co-pays attached that would exceed the amount of original Medicare in some cases. There's managed care that you must consider. You would continue to pay for Part A and Part B premiums, and depending on the plan, you might need referrals to see specialists. Now we're going to review a couple of assistance programs that are offered for Medicare beneficiaries in the state of Connecticut and also nationwide. The first is Extra Help, also known as the Low Income Subsidy. It pays the Part D deductible for a beneficiary and may also pay the plan's premium if you're enrolled in what's called a benchmark plan. For 2021, there will be 8 benchmark plans offered in the state of Connecticut, which means that 8 plans for people who are receiving Extra Help will offer a 0 per month premium. So beneficiaries receiving Extra Help might be able to select from 8 different plans at a 0 premium. If your medications are covered by the benchmark plan, we usually counsel people to choose the benchmark plan that would offer the lowest copays. Copays are set for people on low income subsidy at $3.60 for generics and $8.95 for brand name drugs. Additional benefits for Extra Help or LIS is that people can change plan coverages once each quarter. So every 3 months, someone who's on Extra Help is able to switch from original Medicare to Advantage or Advantage to original Medicare. It also avoids the late enrollment penalty. So for those people who have a Part D penalty, this benefit can help cover that penalty for them. The Medicare Savings Program grants beneficiaries automatic Extra Help and also pays the Part A and Part B premiums in the state of Connecticut. There are 3 different levels for the Medicare Savings Program, which are QMB, SLMB, and ALMB. There are income limits attached to each level, but QMB offers the more extensive benefit because it also can cover your deductibles, co-pays, and co-insurances. This chart shows the income limits for each level of the Medicare Savings Program. This program is administered by the Department of Social Services. It only considers gross monthly income for the applicant, and this is a program that does not take into account assets. Only income, and that's also included the earned working income. There's a calculation where they do discount some of your wages so that you may qualify. And it does operate similarly to a Medigap plan if you're on QMB, because it will be your secondary payer if you're eligible for this. The difference is that there's no vision, hearing, or benefits with QMB. And Medigaps do not have an income limit. A lot of times our beneficiaries get confused between QMB and Medicaid. And just to clarify simply, Medicaid is a health insurance program for low-income people, and it offers comprehensive health insurance coverage, including dental care, hearing, vision, and QMB does not cover those things. It will only pick up your 20% co-insurance if Medicare paid their 80% for medically necessary expenses. Our Choices Department is able to help you apply for Medicare Savings Program. We have paper applications that we can mail over to you and help you fill out over the phone. We're also able to help you apply online via connect.ct.gov, but applications for MSP are approved or denied by the Connecticut Department of Social Services, and they must be mailed to your DSS office by the Scanning Center in Manchester. And also, anyone who is on Medicare may also qualify for Medicaid. There are Husky A for parents and caregivers. There's also Husky D for people who are 64 and younger and not on disability. Those programs are applied for at Access Health CT, but Choices is able to help you understand your Husky C eligibility, MedConnect eligibility, Medicare Savings Program, and also long-term care Medicaid. The application for long-term care Medicaid is handled by DSS directly, however. for Husky C, which is your health insurance for people who are 65 and older or on disability. This is a health insurance that looks at income and assets. Countable assets are bank accounts, stocks and bonds, a second home. What is not counted as assets is your residence, your primary, where you live, your first car, burial policy, and term life policy. This chart shows the income and asset limits for Husky C based off of where you live in the state of Connecticut. We have, I don't recall where Reading is, if it's considered Southwest Connecticut or probably just Western, but for a single person, an applicant must not earn more than $984.49 for Region A or $874 for Region B or C. And you see the married couples there as well. Asset limits are $1,600 total for a single person or $2,400 total for a married couple. MedConnect is another form of Medicaid for people who are on disability and are actively working. This is administered by Department of Social Services as well. People must complete a W-1E application to be considered, and they must be deemed disabled by Social Security Administration or the state. In order to qualify, they must be working with an employer and have taxable wages. With MedConnect, the asset and income limits are a little bit larger. You must earn up to $75,000 per year, and assets are capped at a single person for $10,000 and a married couple up to $15,000. Now, any person who is interested in learning more about Medicare is able to review this information in more detail by visiting medicare.gov. If you're a Medicare beneficiary and you want to see what plans are offered for 2021 during Medicare open enrollment, you can create what's called a mymedicare.gov account, where you would create a username and password. You would create secret questions and answers to secure your account. You can input your prescription drugs that you're currently taking, including the name, dose, and how often you take them. And once you've saved all of that information, you're able to pull up a search for Part D plans that cover your medications and Advantage plans that cover your medications. When you go on medicare.gov, you can find plans by clicking the icon Find Plans, but during Medicare open enrollment, there's going to be a big banner here in the main page that says Open Enrollment October 15th, and it'll also take you to the Plan Finder tool to review your plan options. So to wrap my portion of the presentation up, steps to consider before you choose a plan. Please make a list of your prescriptions, including dose, name, frequency, maybe identify if there are generic options available for some of the brand name drugs you take if you're interested in reducing the cost of your medications. It would be great to determine if you qualify for extra help or the Medicare Savings Program, because you can save the Part B premium every month if you qualify, and also get extra help with the cost of your prescriptions and save on the copays, no more than $3.60 for generic medications or $8.95 for brand name drugs. We also encourage people to probably ask a lot of questions. Don't go by what you see on commercials or radio ads or newspaper ads. A lot of plans do offer comprehensive coverage, but it's important to consider that your total costs are combined with premium, deductibles, co-pays, co-insurances. So for those who have not been very familiar with our Choices program, like I had mentioned earlier, we're located at the Western Connecticut Area Agency on Aging. Unfortunately, during the COVID-19 pandemic, we're not receiving visitors in person right now, and we won't be able to conduct in-person appointments. But we are available by phone Monday through Friday from 8 a.m. to 4:30 p.m. We can provide one-on-one counseling anytime in the year. It could be related to open enrollment or any general questions that you might have about why a benefit was not covered. If you're having trouble with an appeal, we can also assist with that. A little reminder that we will have open enrollment again from October 15th through December 7th. And our statewide choices phone number is 1-800-994-9422. And for the Western Connecticut Area Agency on Aging's Choices, the number is 203-757-5449, and our extension is 134. And now I'm going to pass the mic over to Audrey Cole, who is our Senior Medicare Patrol Volunteer Coordinator, who has updates on COVID-19 Medicare scams.
Hi, all. Thank you for spending time with us late in the day. I should say that I started here at the Western Connecticut Area Agency on Aging in the Choices program. And since then, I'm in charge of the Senior Medicare Patrol, where we basically educate people on how to detect, protect, and report Medicare fraud, errors, and abuse. I kind of call this program Medicare Light because, as you heard Francesca, there's an awful lot of information here, and she only touched on it very lightly as to what Medicare involves. So I'll go through right now what are the current scams that we're dealing with, especially under COVID-19. There is some fraud that occurs a lot with open enrollment too, because people pass themselves off. It's called imposter scams, where they say they represent an agency. I'm sure you've gotten calls where you hear the word Medicare or Social Security, where these criminals basically pretend that they're a representative from Medicare or Social Security or other government, whether it be a federal or state agency. So I'll go through especially when it comes to contact tracing scams that are going on under COVID-19. So I'll be fairly quick, and then at the end you can ask some questions. I've also asked after this for Francesca maybe to distribute some of our flyers and information about who to contact, because I'm in charge of the volunteers who really are our eyes and ears in the community. We're people who have been a victim, or they know a family member who they suspect someone is trying to get their Medicare number from them, or get them to buy something that they don't need, and then to educate them about how to report it to us so that we can in turn report it to the federal government and to the Medicare program. Okay, Medicare, we lose billions of dollars every year in Medicare. It's one of the highest programs where there's loss of monies. In 2017, it was 60 billion. And the Federal Trade Commission just reported that there have been more than 200,000 complaints since March under COVID-19, involving hundreds of millions of dollars. So as I said, we deal with our volunteers at the grassroots level. Next. And our mission is empower and assist Medicare beneficiaries, their families, and caregivers. Three things: prevent, detect, report are the words that we're always telling people to remember, involving fraud, errors, and abuse. And we do this through outreach counseling. We go into the communities and we educate people about what to look for and how to protect themselves from fraud, and then to call us so that we can report it. Next. Okay, COVID-19 fraud, as you know, it's got to do with the SARS-CoV-2 virus. It's broadly defined as a wrongful or criminal deception, that's fraud, with intent, intended to result in financial or personal gain. It's a broad scope of schemes, and it's related to this specific health emergency. Healthcare fraud, supply schemes, cyber scams, and financial crimes. Next. Cures. There is currently no FDA-approved prevention product or cure that's available. They've issued some emergency authorizations for some treatments, but scammers promote a broad variety of false cures. Next. There's also hand sanitizers. Be extremely cautious. There are homemade products being sold out there that are burning people. Follow the CDC current guidelines for all hand washing and the proper use of all sanitizers. Next. Telemedicine, home health care, hospice care, and diagnostic testing and prescription drugs are all areas where fraud is occurring. Next. Telemedicine, it's critical. It's a critical resource during this pandemic because a lot of people can't go into doctors' offices, but there are a lot of bad actors out there. Telemedicine fraud was occurring before COVID-19. People are misrepresenting their credentials. They call you and they try and get your Medicare number. They bill for services that you never receive. That's why it's so important to read your Medicare notices or your EOBs if you have a Medicare Advantage plan. And they're also, a lot of times people are billed unnecessarily for things that they never received or that they never asked for. Next. Be wary of any unsolicited offer that your doctor hasn't specifically said that you need. Pain creams, braces, genetic testing, other unrelated services. Genetic testing is a critical area where, unlike braces, where you could be charged $1,500, these DNA genetic testing scams bill Medicare anywhere from $7,000 to $15,000. Next. Hospice care. It's a valuable resource to the community, and it's provided by very compassionate individuals, but you still have to watch out for unscrupulous providers. Next. For example, people who falsely certify and they provide services who are not terminally ill. You have to be terminally ill to be on hospice. That means that the doctor has estimated that it's 6 months or less that the person is expected to live. Billing for a higher level of care that you actually needed or provided. And also, padding the bills for services not received, and also kickbacks for referrals of people. Next. Diagnostic testing. Telemarketers, they do this by contacting telemarketers, emails, text messages, online offers, and in-person solicitations. They actually go around and knock on people's doors. But the two most common ways of contact now are text messaging and phone calls. Next. Prescription drugs. Some seniors have reported official sounding calls, they use the word Medicare and they'll say like the National Medicare Resource Association or something like that. And then people's ears will perk up, and then they will try and sell them things they don't need and their doctor has not authorized. So you always have to work directly with your physician and your pharmacy to make sure that you're getting what you need specifically and that they have recommended. Next. As I said, these methods of contact, they'll do it through the internet, social media, text and telephone, mail and print, and in person. And more specifically, next. The internet. Scam emails, websites, and social media posts, especially for example, if you're on Facebook, there are a tremendous amount of fraudulent ads being run on Facebook, for example, on social media to sell you products that you don't need. But their method of advertising is to make you think that you need something. Next. Social media, be cautious about posting symptoms and medical conditions on social media. Don't let people know what your illnesses are, because they'll think of somehow you'll suddenly see something related to your medical condition. A lot of times people just, because of the algorithms in these programs, that people will send an email to someone about their medical condition, and the next thing they'll see is all these ads popping up on the side about resources that they can get to treat their medical condition. So the internet is not a private area. Next. Text and telephone. Robocalls and telemarketing often increase during all public health emergencies, and this is in effect a crisis. As I said, treatments, testing, cures, vaccines, supplies. These are all things that they try and offer you to alleviate if to stave off the symptoms that you're afraid of getting, or if you think you have a symptom, excuse me. Next. Text and telephone. Be suspicious of additional services offered by telemarketers, including genetic testing, also known as DNA or cancer screening tests. If you pay for this, if you bill Medicare and you actually need it down the road from your doctor, Medicare will not provide the service normally to you again because it's already been paid for, even though fraudulently. Next. Mail and print, you'll receive letters, flyers, posters. Ooh. Sorry. Yeah, Francesca can answer some of those questions. I saw a question pop up. She'll be able to answer that. And newspaper advertisements. Fraudsters will bombard you at all levels that they think they can reach you. Next. In person. Be especially cautious of unsolicited door-to-door contacts. And sometimes people even put flyers on people's calls. During the initial COVID-19 scare in March and April, there were actual people in parking lots trying to get people to take COVID-19 testing and so forth. A lot of this is just to get your Medicare number, so they can in turn sell that number, for millions of dollars. If they get like 200 or 300 numbers, they can sell that your Medicare number over and over again to fraudsters. Next. So treat your Medicare card like you would treat a credit card. Only share it and other healthcare identification cards with trusted sources, and rely on your doctor only for medical advice and prescriptions, and never sign anything blank, medical or insurance form. I did have someone who actually signed an insurance form contract renewal in Spanish, and they didn't speak Spanish. And we consider that an abuse more than anything, because the insurance agent didn't have an English contract. Well, that's not right. You can't have someone sign something if they can't read it and understand it. Next. Keep records, file copies of all your bills, save your Medicare summary notices and your explanation of benefits, which are Medicare Advantage forms. The Medicare summary notices come out quarterly, and the EOBs are usually on a monthly basis. And check them for accuracy. When people call me about a bill, suspicious bill or whatever, or they feel they've been overbilled, I always say, well, what does your Medicare summary notice say? Because they will sometimes get a separate bill from a provider. So I want to look at those two things and see if they match up. So ask questions of your provider, and call us, Senior Medicare Patrol, and I can assist anybody with any question they may have if they're concerned. Next. Call the healthcare provider, call the company that issued the bill, and contact SMP. We help people research it for clarity to make sure that it's not just an error, that it or if it's fraud, or if it's abuse, which is in effect they're taking advantage of the system. Next. So these are the resources. We have a website that people can go on with all kinds of information about Medicare fraud. And as I said, just contact us here at the Western Connecticut Area Agency to answer any questions that you may have. And if I can't assist you directly, I will get you to someone who can. Next. We are made up of a cadre of volunteers throughout the 41 towns. They give presentations. We also provide one-on-one counseling. And many just come in for administrative work, although we haven't yet opened up again. We've been on hold for that. So we are constantly looking for volunteers. And as I said, we work closely with the Choices program. So we give you people a really kind of you can't understand Medicare fraud unless you understand Medicare. So our training involves almost like, as I said before, Medicare Lite. Thank you for your time. And if you have any questions, Francesca and I will answer them.
Francesca and Audrey, thank you so much. So we're going to open things up now for questions. Again, you can put them in the chat. You can raise your hand to be called on if you do the little symbol, or you can unmute yourself, or better yet, write next in the chat function so we know to call on you. So there is one question. Is hospice covered by Medicare, Medicare Advantage? When do you need to purchase Part B? And what happens if you are still working?
All right, so that's very good questions. Hospice is covered by original Medicare, and beginning 2021, there are Advantage plans that will also be covering hospice care. Part B, the initial enrollment period for Medicare eligibility, it begins 3 months before your 65th birthday, the month of your 65th birthday, and extends 3 months after the month of your 65th birthday. So it's 7 months where you're able to enroll in Part A and B coverage. Part D, some people might choose to delay Part B enrollment if they're actively working and have employer insurance coverage that is deemed as good as Medicare benefits. The same would apply for a Part D drug plan if they have a retiree plan that's covering their medications, or if they're actively working and the employer insurance is going to cover the prescriptions as well, then a person might be able to waive that that enrollment of Part D as well. Once you are retired and you no longer have that, I'm sorry about that, that benefit, you have typically a specific amount of time, depending on whether it's Part B or Part D, to choose that coverage. So if you are someone who is, soon to retire, may have questions about whether or not they have to apply, you can definitely give us a call and we can provide you with more specific information based on your situation.
Thank you.
No
Are there
problem.
other questions out there? If you just, I can't see everyone's face, so just write next in the chat function or type out your question for us.
I think that might help. I stopped sharing.
I said there's still so many of us on that there are several screens,
Yeah.
so it's hard to see everybody. So the best way to get our attention is to write next in the chat function. Any more questions out there? Okay, we do have another question. Is there an age that you must apply for Medicare by if you are covered by an employer?
So I have seen maybe a couple of cases of people who choose to work past the age of 65. I think in general, the expectation is that, and most employers also require a beneficiary to at least enroll into Part A hospital coverage when they turn 65, because Part A hospital coverage is free for most people, especially if they have at least 10 years of working history. So at least when you turn 65, you should have Part A coverage active. And that would make Medicare Part A hospital coverage your secondary insurance if you have active employee coverage. Part B can be delayed if you are actively working, but it is important to keep documents from your provider, your employer rather, that specify that the coverage that you have is deemed creditable. There's, maybe more than 100 employees contracted under your company, and it's as good as Medicare coverage. And once you retire and once that coverage ends, you'll need a separate document from your Human Resources Department that verifies that your coverage will end on a specific date, and that coverage was being provided to you from, the time you were 65 up until that last day. And that will prevent you from facing any Part B late enrollment penalties, or sometimes even the Part D late enrollment penalties as well.
Thank you. Another question, and this one I can answer, is that there will be access to this presentation. We have recorded it. And so give us about a week and it should be on the Mark Twain Library website. All the slides that you saw will be there, and the commentary. And it will also be on our YouTube channel. And then I know Audrey and Francesca said they would also be giving us some materials to forward on to you. So that will be available. We do have another question. When will the 2021 costs for supplemental plans be published? Where can we get them once they're published?
I'm going to review that one more time. Oh, the 2021 costs for supplemental plans. We just had an all-day training today with Advantage plans for the state, and we reviewed the Part D plans. We expect that guide to be available to us by sometime next week. And we will have printed copies here at the agency. If you would like one, I can mail them to you directly. You can give us a call at, I'm going to say my number again, and I'll also insert it in the chat box. Our agency's number is 203-757-5449, and the extension is 134. And our supplemental guide will show you all of the supplemental plans offered in the state of Connecticut, provide you with definitions on what each plan covers and does not cover, as well as the premiums that are varied throughout the different plans as well.
Thank you. Francesca, can you once again review Part B premiums from the lowest standard to the highest?
Sure. So the Part B premium is calculated based on the beneficiary's income. The standard Part B premium for the year 2020 was $144.60 per month. And that is expected to probably rise slightly for 2021. We have gotten the amount of $148.50 a month as the standard Part B premium for 2021. And for most people who are receiving Social Security, that is automatically deducted from the Social Security check every month. And for people who are in a higher income bracket, that monthly premium can be, thank you, Amanda, $202.40 a month for people who are within the income of $87,000 to $109,000 a year for a single person. Or for a married couple, $174,000 to $208,000 a year. So that's the $202.40 for that Part B premium in that income bracket. The $289 premium is for people who are single, earning from $109,000 to $136,000 a year. And for married couples earning $218,000 to $272,000. So those are the Part B premiums that are associated to your benefits based on income.
Thank you, very good. Anyone else who has a question? Those are all the questions I have in the chat. I'll give you another minute if you want to type something in, or if you'd like to ask your question personally, you can just let us know by writing next in the chat.
And I'm adding my phone number here.
Okay, Eleanor, if you would like to unmute yourself, you have a question you'd like to ask, that would be great. Are you able to unmute yourself?
There we go. There we go. Okay, my question is, I am blessed to have a retiree plan, but I have people telling me to get rid of the retiree plan and go on an Advantage plan. How do I decide? How do I decide what's better?
I would be very cautious about disenrolling from retiree benefits at any point, because once you've disenrolled in a retiree benefit, you would probably have a hard time getting that back. And usually with the retiree benefits, there are additional benefits included into that. Even if your employer is in an Advantage plan, you might have added benefits to your plan. They might help you pay premiums with that retiree insurance. You might have lower co-pays with that. Personally, I don't know of many of our choices department who would counsel someone to disenroll from a retiree plan and go into a different Advantage plan. I mean, it would really be interesting to hear the, the observation of the person. There aren't necessarily restrictions to changing your coverage because any person on Medicare is able to switch at least once a year through the open enrollment period. But the only restriction that I can probably tell you is if you disenroll from a retiree account, you might not ever get that back.
Yeah, I do know from coworkers that you can drop it once and get it back, but you can't ever do it twice.
I think every employer is slightly different, but what I would say is if you'd like to give us a call, we can have a one-on-one conversation about what you're looking for that your retiree doesn't offer and see if there's something that we might be able to help you with in that.
Okay, and that would be the 203-757-5449 number?
Yes, that's correct.
All right,
Extension 134.
great. Okay, thank you very much.
You're so welcome.
Are there other questions out there? We'll have to take this time to make sure we've covered everyone's questions.
These are all great questions.
Okay, well, thank you. Audrey and Francesca, thank you so much for being with us today. We know you're available. It's great to know these programs are out there. And so I encourage everyone to take advantage of your services. And Mary Dale and Sarah, thank you so much. And for the Commission on Aging for bringing this program to us. So valuable.
Thank you. Thank you very much.
For having us.
Thank you.
Bye-bye, everyone.
Bye-bye.
Bye.